Hello everyone, how are you? I hope you all are doing good and well. So, today we are going to see about the gastric acid secretion inhibitors. So, first we will see about the normal physiology of parietal cell which is present in the stomach. So, what happens? Uh, Firstly, we have a pump here which is called as proton pump. Okay, and we have a receptor which is M1 receptor. We have a gastrin hormone here and H2 receptor, okay, on parietal cell. So if we see the working of the parietal cell, so what happens? The parasympathetic system secretes acetylcholine which activate the M1 receptor, and then M1 receptor increases the intracellular calcium which stimulate this proton pump. Okay, so when the proton pump is stimulated, what happens? It releases H plus ion in exchange of potassium. So that's why it is also called as hydrogen potassium pump. Okay, so when suppose this is the lumen of the stomach, as H plus ion is come in the lumen, here chloride ion is present, so these both fuse together and form the HCl, which is a hydrochloric acid in the stomach. So the more will be the H plus ion, the more will be the HCl. Okay, so if this pump is getting stimulated, so acid will be more in the stomach, we can say that. Okay, another thing is the gastrin hormone. What happens when H plus ion decreases? When H plus ion decreases in the stomach, so it sends a signal to the brain, and it releases the gastrin hormone, which again activate the CCK B2, which again ultimately increases the intracellular calcium, which stimulate the proton pump. We also have H2 receptor, which is nothing but a histamine receptor. So histamine will activate this receptor, and this receptor will increase CAMP, which will stimulate this proton pump. Okay, so as we are seeing that the three mechanisms are going on here to stimulate the pump, which is proton pump. So if we need to decrease the acid production in the stomach, so we need to inhibit the mechanism of this proton pump. So first we have anticholinergic drug to stop the mechanism of parasympathetic system, so that it will not stimulate the proton pump. Okay, this is the first category. Second, we have antihistaminic, like not that allergic antihistaminic, but H2 blockers. Okay, so H2 blocker, if we inhibit this, so CAMP will not be increased and it will not stimulate the proton pump. Then we have one more category of drug which is considered as the most potent drug, which will directly inhibit this proton pump. Okay, so one by one we will see the drugs. The first category, which is parasympathetic, which is anticholinergics, we have pyrazapine, then we have propanthelin, then again we have telenzapine, okay. So these are the drugs which will work by the mechanism of anticholinergic. Then another we have the drugs which will block this H2 receptor. So this drug will end in tidine. Okay, like cimetidine, ranitidine, famotidine, roxatidine, loratadine. And the third one, which is the inhibitor of the proton pump. Why it is first we will see why it is considered as the most potent drug. Because just assume the person is having a ulcer here. This is the lumen of the stomach, peptic ulcer. If acid will touch, so it will not heal and it can perforate. It can break this membrane and bleeding, internal bleeding can happen. So if we'll block this acetylcholine, okay, we will give this drug. But what about this histamine? If the histamine will stimulate the proton pump, then again it will release the H plus ion, which will form the HCl, and it can again harm the ulcer. We can't take a risk here. Okay, so that's why the proton pump inhibitor. If we will inhibit this pump only, then if any stimulus come to this pump, then also it will not going to work. So that's why it is considered as the most potent drug. So we will see first the example and some more important points about it. We have omeprazole, esomeprazole, pantoprazole, lansoprazole, then rabeprazole. Okay, so you would have seen like whenever doctor is prescribing like paracetamol, any of the NSAID, so he will give PPI, which is these drugs are called as proton pump inhibitors. Okay, so he will give proton pump inhibitor. Why? When we give any of the NSAID, ibuprofen, naproxen, paracetamol, diclofenac, aceclofenac, so we know it inhibits the COX enzyme. Okay, due to which in our body prostaglandin synthesis will be low. And what is the work of the prostaglandin? It protects the lumen of our stomach from the acid. Why? It increases the mucous membrane and it also inhibits the proton pump. Not like that inhibit, but it regulates the proton pump. It decreases the secretion of acid which when it is more. Okay, so if prostaglandin are low, so this mechanism will be not there, or it will be low. Okay, if this is low, mucous membrane is thin here and pump is not getting its intensity low, so HCl also will increase, so it can touch the membrane of the stomach and cause the peptic ulcer. That's why whenever we are giving NSAIDs, we will prescribe a patient like gastric acid suppression drugs, okay, or gastric acid secretion inhibitors. So as we are seeing that prostaglandin are decreasing the proton pump intensity, so we can do one thing, we can also give the directly prostaglandin, right? So we have one more drug which is a prostaglandin analog, which is misoprostol. Okay, so it will again decrease the intensity of the proton pump. One more thing about the proton pump inhibitor, it blocks the proton pump irreversibly. If this proton pump is blocked, so it will not work again. And around after 24 hours, this cell will form new proton pump. Okay, so we can say that this medicine will work for 24 hours around. Okay, so that's the thing. Now about the proton pump inhibitor, we have one more thing to see, like these drugs are inhibiting the proton pump, but these drugs are acid liable. What does it means? If we take it orally, so it will go into stomach, and if it comes in contact with the HCl, then this medicine will get destroyed. So what we did, that's why we give a proton pump inhibitor in a capsule form, which is an enteric coated capsule. Which protect the molecules of proton pump inhibitor from the acid, and after going into the intestine in the alkaline medium, this enteric coat get dissolved and medicine come into the contact with the lumen and get absorbed. Okay, and one more thing, the side effect of the when we see the side effect of the proton pump inhibitor, side effects, so first thing is the it will decrease the absorption of vitamin B12. Why? In parietal cell, proton pump is not only secreting the H plus ion, but it also secretes the intrinsic factor. What is the work of intrinsic factor? Intrinsic factor do the absorption of vitamin B12. So if we inhibit the proton pump, intrinsic factor will be low, due to which vitamin B12 will not be absorbed. And when the vitamin B12 deficiency is there, so we see one condition which is called as megaloblastic anemia. Okay. Another side effect which we can see is, if we will give in elderly women this medicine, as we know, the estrogen is not there or in a minimum amount after the menopause, so calcium is already low in the body of the woman, and this medicine also decrease the calcium level. It interferes with the absorption of the calcium, because acid increases the absorption of the calcium, or it stimulates the absorption of the calcium, and if we decrease the acid, so calcium absorption is affected, so osteoporosis can be seen. And then we can also see increase in the infections. Why? Because acid is one of the defense mechanism of our body. If any bacteria goes through our mouth, so acid will try to kill that bacteria, but if we suppress the acid, so bacteria will survive and there are more risk of the infections. Yes, and when we see the uses of the proton pump inhibitor, so firstly we have it is the drug of choice for peptic ulcer disease. Okay, drug of choice for peptic ulcer disease. Why it is drug of choice? I already told you, as big, because if we block the parasympathetic system, histamine can work. If we block the histamine, parasympathetic can work. So we can't take any chance in the peptic ulcer disease, because it will cause a severe pain to the patient, and also the ulcer can perforate if acid is there. So we will directly block the pump. Then it is also a drug of choice for GERD, which is also the full form of GERD is gastroesophageal reflux disease. C for GERD. Okay, and also like it is also like drug of choice for bleeding ulcers, bleeding peptic ulcer, and also we can give it in stress ulcers. In next video I will explain you about the ulcers like peptic ulcer, stress ulcer, the pathology, physiology, and ultimately with that I will teach how the drugs will act and how we can treat these patients. Okay, so that I will teach in next video. So we also give this thing in the Zollinger Ellison syndrome. What happens in this syndrome? There is in this syndrome there is a gastrinoma, okay, which secretes gastrin, as we see, which secretes more amount of gastrin, due to which more proton pump will stimulate and more acid will be there. So we need to suppress that. So in that condition we will use. Okay, and in stress ulcer we will give the proton pump inhibitor IV. We can use IV pantoprazole or rabeprazole. Okay, and we also have one more use, which is aspiration pneumonia. What happens when patient is in coma? Okay, so acid is producing. Okay, and if the pyloric sphincter is not working properly, so acid can go into the like through the larynx, it can go into the lungs, and if it will go into the lungs, it can cause the irritation there. And after the irritation, what will happen? The like exudate will form in the lungs and can cause the pneumonia. So to stop that, we will give a PPI to the patient who is in the coma or in the prolonged anesthesia condition to inhibit the acid secretion. Okay, so that's the first like before H2 blocker were used, but after the decade, like when the H2 blockers were used, after a decade the proton pump inhibitor were formed. So that's why firstly H2 blocker were used, but now PPI is the drug of choice, proton pump inhibitors. Okay, so I hope you all liked the video and the content I shared with you. I tried to cover as much as possible, and I also used the referred books like KD Tripathi. I used to cover all the things as much as I can. And please do like, subscribe, and drop a comment if you like my content, and if any changes are needed, please also suggest me so that I can improve in the further videos. Thank you so much guys for watching.